DW Veterinarian Sandi Sawchuck is here taking your calls at 270-9933.
Hey, Sandy, nice to see you.
Nice to be here.
You brought an Easter lily for us.
I brought you a present because you don't have cats, okay?
I have a cat.
So you can't take it home. This happens to be one of the most toxic plants you can bring into your house.
Really?
All the cat has to do is just chew on the leaf or even get some of that yellow pollen on their hair coat and groom it off. And it can put them into acute kidney failure. And it's not a nice thing to have happen. And when I purchased this, I just bought this afternoon, there is no warning on there regarding cats. So I wanted to bring this out that, you know, make sure that if you do have a kitty at home and someone gives you a lovely plant like this, that you keep it in another room away from the cat.
And no problem for dogs.
No problem for dogs, but even if you plant them outside, if you have indoor-outdoor cats or other lilies, that can be a problem as well. Any of the stargazer lilies or the Asiatic lilies that many people put in their gardens in the springtime can be a problem. So when you're planting those bulbs, plan accordingly.
I have tons of them.
Okay, well, I'm glad you don't have any cats.
I don't. All right, let's get to the calls. We'll start with Sue from Mount Horeb. Hi, Sue.
Hi, how are you?
Great. What's your question?
I have a new golden doodle medium-sized puppy, 7 weeks old, very active, had been exposed to an awful lot, and I want to take her to puppy class as soon as it's safe. And she's had vaccinations when she was 5.5 weeks. She had the combo, the distemper.
Yeah. And when we she hasn't finished her vaccination protocol, obviously. We normally give vaccines out until about 16 weeks of age and sometimes longer, depending on the size of the dog. But the important thing is that I heard from you is that you want to take your dog to puppy training class, and that is so important. Every dog should be vet checked, as well as having at least their first vaccination. And they should also get a kennel cough vaccination if that hasn't already been given by the breeder. At that point, then, you can take your dog to puppy training class because all the dogs are in the same boat. But I would not be taking your dog to the dog park, to a pet store where no one's patrolling what dogs are coming in and if everybody's been vaccinated. All the training centers are going to have cleaning supplies and washable floors and are going to not allow a dog there that's sick. The chance of your dog picking up a disease at the training class is so low compared to your dog being antisocial if you don't take them to a training class. So get them out and get them socialized, and in those controlled environments, that's the best way to go.
They usually require proof of vaccination.
Oh, they require that they've been checked by a veterinarian, not just vaccinated, but also checked. And they usually want a negative stool check for parasites as well.
Oh, okay.
All right.
Let's go to Lynn in Janesville. Hi, Lynn. What's your question?
Hi. I am disabled, and I have a 6.5-month-old mini Aussie puppy who is very active.
Lots of dog.
Yes, and he's very good at fetching, and he's potty trained, and he knows sit. But I'm trying to teach him like down and to give paw and things like that. And with me not able to get on the floor with him, I just can't do it. So my first question is, at this age, is he still trainable?
Oh, good question.
You can teach an old dog new tricks very easily. Okay, so yes, your dog is very, very trainable. You've got one of the smartest breeds, at least in my experience, and active breeds. And I'm just wondering if you did any breed investigation before you adopted this little dog. But it sounds like you're off to the right start. You are teaching some manners, and you know, even if you are take him to a training class, a reputable trainer will be able to help you with unique situations like this on how to teach your dog how to lay down or how to sit appropriately. So I would still, even though you may not be able to be moving around in a circle as quickly or getting down on the floor with the dog, don't give up on training classes and look in your area. And I know even in the Janesville area, we do have some very good training centers. That's where I live, and they'll be able to help you, and then you'll have not only a smart but a well-trained dog.
All right, we'll go to Michelle now, also in Janesville. Hi, Michelle.
Hi.
What's your question?
I have a 6-year-old German Shepherd Husky mix, and she is an absolutely delightful dog, except for one thing. She is very dog reactive.
Oh, yes. And this...
And I've done, like, the correction things, like trying to do, like, a loud, like, to get her to break that focus. You know, and I've tried to do some of the manners and some of that, but I I feel like there should be something more that maybe that I could do, because I've had her to training places.
Yeah, and most of these dogs that have this type of problem it's a fear-based reaction.
And it is.
And yes, and so when you start reacting by making a loud noise, jerking on the leash, doing anything like that, that's just sending that message that this is really something to be afraid of, because mom's reacting, I'm reacting. So your best bet is to work with a certified animal behaviorist or someone that is well-versed in gentle dog training and using positive reinforcement and having actually therapy dogs that can be used at a distance, so your dog gets used to these dogs that will not react no matter what your dog dishes out, so that you can then get your dog to be calm and cool and collected in those situations. But having your dog out in public with random dogs who you don't know how they're going to react, that could really be a problem. So it's going to take time, but it is something that can be corrected.
Especially the German Shepherd mix. It's an intimidating dog.
Again, it's a big dog, and yeah.
All right. Quickly, Marlene from Fitchburg, what's your question?
Yes, my question concerns a 6-year-old cat that I acquired a year ago when her elderly owner moved away. Within a week, she was at UW Vet Hospital and not eating, and was diagnosed with pancreatitis.
Okay.
And when they did the ultrasound, they of course had to shave her stomach. She also had 3 bracelets shaved on her legs for IV.
Right, right.
Well, she has successfully been able to maintain that bare tummy look.
Okay.
Okay, we got to go.
Yeah. All right. Very quick,
Yep.
Look up fur mowing online, like mowing your grass. There's a very good article there from a group called Veterinary Partners, and it's wonderful. It gives you all the rule outs for why a cat may overgroom. It can be stress, it can be parasites, infection, all kinds of things.
Say it again, Sandy. What was it?
Fur mowing.
Like mowing the lawn.
Okay, like mowing the lawn.
Look it up.
That's good to know.
All right. Lots of good questions as usual. Thanks for calling in. We'll get to you next time. Thanks, Sandy.
Thanks,
You're
Sandy.
welcome.
Good to see you.
Happy Easter.
Yeah,
Happy
to you
Easter.
as well.
We'll be right back.